Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the MCP and IP joints of the thumb biomechanics. So MCP joint is a between of first metacarpal and base of proximal phalanx. It is a condylite joint with 2 degrees of freedom, that is flexion and extension, abduction and adduction. The joint capsule, volar plates and collateral ligaments are similar to other metacarpal joints. Its function is to provide additional flexion range to thumb in opposition and to allow thumb to grasp and contour to objects. Through structure is same flexion and extension, ranges are half of other fingers. Abduction adduction is extremely limited. Next is IP joint. IP joint is between the head of proximal phalanx and the base of distal phalanx, similar to other IP joints of the fingers. Next is musculation. Extrinsic thumb muscles are 4, which includes flexor pollicis longus, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus. FPL is insert on distal phalanx, correlates to FDP, at first invested by radial bursa, which is continuous with its distal tendon sheath. Its function independently, only muscle responsible for thumb flexion at IP joint. It sits between sigmoid bone, derives some protection from the bone. Other 3 muscles are located dorsal-radially. FPB, EPB and APL common course, dorsal form and first compartment radial aspect of the wrist. EPB is the extension of the result in the extension of the MCP joint. And EPL is insert on the base of the distal phalanx, help in the thumb extends but in neutral position, but no hyperextension, extends and abducts in first carpa metacarpal joint. Intrinsic thumb muscles. There are 5 thenar muscles. One is opponens pollicis and FDP, AVP, FEP and ADP. Larger head attaches to ABL, which leads to abduction of the thumb. Medial head attaches to ADP, which leads to adduction of the thumb. The first dorsal intersi result is not considered as thenar muscles but contributes to thumb function, that is CMC joint distraction, assist thumb adduction. The thenar muscles is result in the active in the most grasping activities. The activity of the extrinsic thumb muscle in grasp is partially function of the helping to position the MCP and IP joint, and the main function being returning the thumb to extension for on its position. Thank you.